Hey everybody, it's Chris Miles with Wake Forest Baptist Health Sports Medicine. I'm one of the sports medicine physicians here. Really appreciate the opportunity to get together and talk to you today about what is sports medicine, what can we do here to help you stay active, feel good, stay in your sport or your activity, whatever that may be. And hopefully share some information that you can find to be helpful for you or for your family or someone you know who's either had an injury or is in the process of starting a new training program or something that may lead them to have a musculoskeletal or other health condition that we hopefully can get you back in the game with. So we are live here. We're a little bit late. Anybody who knows me knows that's not all that atypical. I do apologize about that, but I think we're rolling now. So we are located here at our sports medicine facility off of Stratford Road. We're combined with the D1 group. This facility is an amazing place if you haven't had an opportunity to see it. We have our physician offices here. We have our physical therapy offices here. We're blessed with some great physical therapists that are very sports medicine focused. In addition to that, we also have the D1 facility, which is a weight room. You might be able to see that behind me, as well as a indoor football field and 2 full-length basketball courts. So it's really an amazing facility. It's a great place to be able to practice medicine, and come on out and have a look at it if you haven't had a chance to. So one of the questions I wanted to address today is what is sports medicine? What is primary care sports medicine? What do we do? And really it's any type of either musculoskeletal conditions, so fractures, sprains, strains, muscle tears, those sorts of things. It's concussions, it's heart illnesses in athletes, it's heat illness, lots of things that are not just musculoskeletal related that we address. Within sports medicine, there are kind of 2 approaches. There's a surgical approach, and that would be my orthopedic sports medicine colleagues, and then the primary care sports medicine, and that's what I do. And that's really any non-surgical condition. And so if somebody has an injury, our job is to decide, is that something that can be treated without a surgery? Or is it something that would need to go on and see my surgical colleagues in the orthopedic world? And the nice thing about our facility here is we have both of those types of physicians. I would say the majority of injuries can be treated without a surgical intervention, which is encouraging, right? We want you to not have to have a surgery and be out for weeks and weeks and weeks. And so we generally will start by seeing the patients and then making that determination moving forward. What types of injuries? As I said before, it's everything you can think of that has to do with the musculoskeletal system or with athletics. And I want it to be very clear that athletics doesn't mean that you necessarily have to play an organized sport. Maybe you're involved in a walking program or a running program, or maybe you're active in the garden. We say that everybody is an athlete in the game of life, and I think that's really true, that all of those activities can predispose you to something that we can treat, again, either non-surgically or if the condition is severe enough, then maybe with a surgery. So I definitely want you guys to send us some questions or comments that you may have as we kind of roll along this. If there are specific conditions that you have questions about or anything that we can answer, please feel free to reach out to us, and we'll try to address those today. One of the things I'm often asked is, what are some of the common conditions that you see? And I say, really, the answer is it varies on the time of year. Right now, as we get into the spring season and the weather's getting nice, it's a beautiful day outside today, they tell me, you're going to be outside being more active. And that may be picking up a running program, that may be picking up your golf clubs and dusting those off, getting back out and doing that, or it's yard work. It's all those things that gets us more active, and we encourage that. We know that exercise is a form of medicine, and it helps all kinds of things. So we want you being active. But this time of year, as we kind of increase back into that, we do see an increased number of injuries. Some of that is that people are picking up their activity too quickly. We want to really encourage, as you resume an activity or if you start something for your first time, to do that slowly, to progress kind of gently into that activity. If somebody needs some guidance with that, that is certainly something that we can help you with. And if you wanted to meet with the idea of developing an exercise plan or an outdoor activity plan, certainly would be happy to meet with you and kind of come up with that sort of thing. But back to the question about what kinds of injuries do we see. This time of year, we tend to see a lot more ankle injuries, so ankle sprains, sometimes fractures, and a lot of that has to do with the activities that people are doing are more outside, sometimes ball sports like tennis, or things where there are tripping hazards are going to lead to ankle injuries. So I'd say that would be number one. Number two, we start to see an increase in our concussions this time of year. Fall is probably the biggest time for concussions because of football, and soccer's maybe a little bit more active in the fall. But we start to see an increase in those during the spring as spring practice starts, and then some of those other sports that can lead to those become more prevalent. Besides ankle injuries and concussions, we see some rotator cuff issues, so injuries in the shoulder, and that can come in two different kinds: acute injuries, so an acute tear of your rotator cuff, or kind of a chronic overuse as you start to work on your golf swing, or you start to pick up a racket sport, or you're throwing the baseball more with your kids. We start to see some more of those rotator cuff type injuries. I would say that knee injuries, those can kind of happen all year long, but as people are starting to run more, we start to see some more of the runner's knees. So things like iliotibial band or IT band syndrome, patellar tendonitis, osteoarthritis starts to rear its ugly head in folks that become more active. So those kind of knee injuries are things that we will see. Outside of those kind of general things, as people start to run more, we think about things like shin splints or foot injuries, plantar fasciitis. All of these conditions that are more common in active people, again, we're going to start to see more this time of year. I think that the interventions for those types of conditions that I just referred to, in the vast majority of people, are going to be non-surgical. And so seeing someone like a primary care sports medicine doctor is really the right place to start for that. Now, your primary care doctors will probably have kind of the basic knowledge of how to diagnose that and maybe some initial interventions. But if there's any question on how to proceed, or if that initial treatment plan isn't really getting you better, we really encourage you to come out and see us and help us, or let us help you kind of get back to that activity. One of the major concerns that we hear when we do treat those kinds of activities is the doctor going to keep me from being able to go back to my sport? Or is he going to tell me that I can't run for the next 4 weeks? And our goal is absolutely the opposite. We want to get you back to your sport, to your activity, as quickly but as safely as we can. And in order to do that, what we know is it's not complete rest. We don't want you shutting down all of your activities. We actually call it activity modification. And so if you're a runner and you have lower leg pain and you have plantar fasciitis, or you have a stress injury in your foot, we're not going to tell you don't do any more running. What we're going to do is we're going to work with you to find a way that you can do modified running. So maybe pool running, or using the elliptical, or those things that take stress off of that area that the injury is, but allow you to still stay active, so that that race that you have circled on the calendar, or the big game that you have coming up, we're able to get that back, get you back to that. Again, I want to thank you guys for letting us be here, and I want to remind you, if there are questions, please feel free to send those in. We'll definitely try to get to some of those today, and if we don't get to those today, then we'll certainly take some time over the next few days to get back to you. So I guess if there's anything in particular that you guys have, send it our way. One of the questions that has kind of come in is, should I be worried about popping in my knees while exercising? And that question came across, and I think it's a very good one. Popping can be very normal. It can be true for all of our joints that popping can occur. Really, the distinction that we use for popping in a joint is whether or not that popping is painful. A painful pop in any joint is something that we do want you to be nervous about or be worried about, and something that we would want to evaluate you for. But if that popping is not painful and it's been something that's been there in your whole life, or it's something that really doesn't give you any trouble other than the sound of the popping, we tend to not get too worried by that. But if there's any question, again, I always go back to it's better to come see us and let us tell you that everything looks great than to do something that may make you worse. But in general, popping, as long as it's not painful, is okay. Another question that has kind of come in that we'll address is nutrition. Absolutely, nutrition is along with sleep, I would say nutrition and sleep are the two key components to musculoskeletal and athletic wellness. We have to have those building blocks of the macronutrients, the proteins, the carbohydrates, the fats, so that our body can recover, our body can continue to get strong, and to be able to have all those abilities for our athletic endeavor that we need. Nutrition is absolutely key. This time of year, and especially in North Carolina, I think they said it was going to be in the 80s already today, but another key element that would fall under nutrition is hydration. And as we pick up our exercise habits and we start to get back outside, and whether we're working in the yard or whether we're training for a marathon, staying hydrated is absolutely crucial to help prevent injury and just for our overall health. So regarding nutrition, very important. We could do a whole nother lecture series on nutrition, so I won't get into all the specifics, but just make sure that you're getting your proteins, you're getting your carbohydrates, you're eating your fats, and then most importantly this time of year is staying hydrated. All right, that's a great question. Is as we talked about earlier, is that slow progression. As you start your activities here in the spring, or you're getting back into things that seem to be that you took a little bit of a break from, is how do you progress with that? And for runners especially, but really for any activity, we talk about a 10% rule, that the increase in mileage or time, depending on how you're doing your training, should never be more than about 10% in any given week. And so for someone who is running 2 miles 3 times a week, or they say 6, so a total of 6 miles in that week, we wouldn't want you to go much more than 0.6 of a mile in that next week, or for any of that weekly mileage. And we do think that there's the potential to reduce stress and overuse injuries by using that 10% rule. Gotcha. So this is a great question, and so there's some newer technology out and some newer interventions that sports medicine doctors and some of my physical therapy colleagues are using, and some of those are things like dry needling or a deep tissue massage kind of scraping technique. And the question is that something that's helpful? And the evidence is kind of mixed for some of these, but overall I do lean towards the fact that there is some real benefit behind those kinds of modalities, those technologies. So the question is, can we offer that? And the answer is absolutely. Our physical therapists are trained in dry needling. They're trained in kind of a scraping technique. There are a couple different styles of that. But that deep friction and that irritation to certain tissues can actually have a real benefit. And so there are times where we as physicians will prescribe that, or our physical therapy colleagues will use that technology or those techniques to help you get recovered. So yes, that's a great question, and certainly something we do. Along the same lines, some more advanced interventions that we have from the physician side in terms of things like PRP. PRP is a term that is platelet-rich plasma. It's a technology where we draw some blood from your body. We spin it down and we get a substance that is really thick, full of platelets and some fancy term is cytokines, or chemicals that help regenerate or help with inflammation in certain areas. We're then able to use that PRP and inject that into certain areas of the body for things like arthritis, some tendon tears, muscle tears. This is a technology that's very early in its infancy here in the United States. They've been doing it a little bit longer in Europe, but we do offer that here. It's in the range of an experimental treatment at this point, but the evidence is starting to grow that there are certain conditions that PRP can help. Same is true for stem cell injection. And again, these are technologies that we are developing and improving upon here at Wake Forest Baptist, and especially here in the sports medicine world. And so if you have questions about those, certainly send that our way and we can talk about it. It looks like there's another question that's come in about cross-training. And what is cross-training? And what I define cross-training is doing something different from your main activity. And so if you're a runner, cross-training would be doing some weightlifting or some swimming or some cycling. If you're a soccer player, cross-training may be playing baseball or a weightlifting or doing some swimming. So it's taking that main activity that you spend your time doing and adding some other physical activity to that. And the question is that important? The answer is absolutely important. Repetitive activities increase the risk of stress injury, increase the risk of muscle fatigue or burnout, and so using that cross-training, so you're continuing to stay active, but working on other muscle groups that are important for your activity will allow you to not only stay safer, but also excel in that activity. So I think that cross-training is exceedingly important, regardless of your sport or regardless of your activity, and we certainly do encourage that to be continued. Question of how old is too old to start running? And I would say there is no age that's too old to start running, though there may be some limitations or some modifications to that running activity that we would encourage. I think there are lots of things, whether that's our weight, whether that's medical conditions, whether that's the age, that people might say, oh, I can't run or I can't get active because of that condition. And really, we can help overcome any of those obstacles that may be out there. I think that some of the interesting stories of people in their 70s or 80s or 90s finishing full-length marathons or doing Ironman triathlons are some of the more inspiring stories that we see and that we hear about in sports medicine. And so, is there an age that's too old? No, but I would certainly encourage folks who are picking up an activity for the first time to discuss that with their physician. Is it safe? And if it's safe to start running at one intensity and allowing for that kind of guided intro to that activity. And so again, if you're picking up anything for the first time, I think it's important to discuss that with your physician to make sure it's safe for you to do that. What about when should I come in? And that's a great question. The question is, when injured, should I wait and see how I do, or should I come in and see you immediately? And I think it really depends on are you now unable to do an activity that you like to do or wanted to do or need to do, like work, because of that injury or that pain? And if the answer is yes, the pain is keeping you from doing something, absolutely come in and see us. And the caveat would be, if you ever have a question, gosh, do I need to see the doctor for this or not? I would always encourage to err on the side of, yeah, come on in, let us tell you, hey, I think this is going to be fine, as opposed to doing something that may prolong your symptoms or may put you at risk for other things. You could turn a non-surgical condition into a surgical condition by pushing through something that maybe we could have treated conservatively. In regards to when can you come see us here at Wake Forest Baptist Health Sports Medicine, we have 6 days a week we have clinic hours. We start at 8 a.m., go through 6 p.m. On the weekdays, and we have Saturday hours, 8 a.m. to noon, and we're here staffing this facility during all those times. And so we really want to try to be available to you all. We want to be here. We want to get you the care that you need. And when I'm not here, so one of the questions, what do I do when I'm not here at D1? I have the pleasure of being the team physician and medical director of athletics at Wake Forest University. Get to care for their athletes, get to be on the sideline with them, get to travel with them. It's just an awesome experience, and really a great blessing to work with that kind of athlete. And the neat thing is to be able to take working with that high-level potential professional athlete and being able to apply that to the everyday athlete or the folks that come in. besides Wake Forest, our group also is involved with Winston-Salem State University. We're the team physicians for the DASH, the official healthcare providers for sports medicine at the School of the Arts. And so really anything that you guys can think of in the triad that involves athletics, we are involved in their care. And that's really just a great opportunity for us and a neat partnership. And so as we get close to the end here, I just want to really encourage you to please send in some questions. Feel free, even after this is over, we're going to respond to those. We're going to get back to you in a timely manner in the next 24, 48, even 72 hours. But if there are any questions that you have for us, please send them our way. We hope, we always say, we don't take this the wrong way, we hope that we don't have to see you here because we want you to stay healthy. But if there's anything that we can do that's a musculoskeletal or a health-related, athletic-related question, please come on in and let us have a look. Thanks for your time. Have a blessed day.